Dietary support for families. At our annual conference in April 2025, specialist dietitian Sarah Flack delivered a thoughtful and practical session on one of the most challenging aspects of living with BBS, managing hunger, food and weight. Sarah has worked within the specialist BBS clinics since they began and understands both the medical complexity of the condition and the daily pressures families face. Her session explored not only the biology behind hunger in BBS, but also realistic strategies that can help in everyday life. Children and adults with BBS usually have lower energy needs, yet often experience stronger and more persistent hunger signals. This mismatch makes weight management especially difficult. Hyperphagia, or excessive hunger, may present as frequent requests for food, including during the night, seeking out additional or hidden food, or becoming distressed around food. It is important to note that these behaviors are biologically driven. There is no single diet that works for everyone with BBS, and support must always be tailored to the individual. Around 70% of children with BBS experience obesity from a young age, and between 72 and 86% of adults are affected. While these figures are significant, there is encouraging news. Data from Great Ormond Street Hospital shows that around 60% of children reduce their BMI between clinic appointments, and a further 9 to 10% maintained a healthy BMI. With consistent specialist input and steady, manageable changes, progress is possible. Families are navigating these challenges within a modern food environment where food is widely available in shops, schools, workplaces, and through delivery services, and where celebrations and social events often centre around eating. For those living with BBS, managing food can feel like a full-time responsibility, requiring planning, supervision, and emotional resilience. Research led by Dr. Elizabeth Forsyth has shown the wider impact hyperphagia can have on family life, including disrupted sleep, increased household stress, avoidance of social situations, and feeling judged by others who may not understand the biological drivers behind eating behaviours. In response to feedback from families, hyperphagia questionnaires have been developed for parents and carers and for young people aged 11 and over where appropriate. These are now used in specialist clinics to help teams better understand hunger behaviours and tailor support accordingly. Sarah shared practical strategies that many families already use. When children start nursery or school, it can be helpful to inform staff early about BBS and hyperphagia, explain that food-seeking behaviour is biologically driven, and prepare children in advance for food-related events such as parties or celebrations. Clear communication can reduce misunderstanding and protect children from unfair judgment. Portion guidance can support balance without strict restriction. Using smaller plates can help meals remain visually satisfying. Offering water instead of fruit juice can reduce excess sugar intake, and the hand can be used as a simple guide for portions. A palm-sized portion of protein, a fist-sized portion of carbohydrates, and a cupped hand of vegetables. The goal is steady balance rather than rigid control. Sleep also plays an important role, as poor sleep can increase cravings for high-energy foods in both children and adults. Supporting consistent sleep routines may therefore help with appetite regulation. Physical activity does not need to involve formal exercise. Building around 20 minutes of movement into daily routines, whether through walking, active play, or dancing, can bring meaningful benefits. NHS resources such as the 10-minute shake-up games and your local authority's local offer pages may help families identify accessible activities. Sarah encouraged families to make the most of clinic appointments by completing food or behaviour diaries where possible, bringing questions and openly sharing what is and is not working. At Great Ormond Street Hospital, families can use My GOSH to stay in contact between visits or request local dietetic support. Managing hunger and weight in BBS is complex and ongoing. The key message from Sarah's session was clear. These challenges are rooted in biology, not willpower, and specialist, compassionate support makes a difference. If you would like to discuss dietary support, please contact your patient liaison officer. Search NHS 10-minute shake-up games in any search engine to access the games.